Hello, my name is Chris Atto. I am an occupational health psychologist and head of research and development at Maudsley Learning. My background is in clinical services and mental health education and workforce development in particular, and I have a real interest in how we can help staff to feel supported, valued and engaged in the workplace. Our R&D team at Maudsley Learning is super diverse. We have a range of people from different backgrounds, including clinical backgrounds, educationalists, researchers and psychologists, all with interests that revolve around mental health in lots of different settings, including the workplace, the well-being of staff, and how we can develop organisations and workforces effectively. Our work is influenced by working across multiple disciplines. So we work a lot with different clinical professions, we work a lot with organisational or occupational health psychologists, and we work with various different academic and research disciplines as well, all bringing together our activities under the aim of trying to support the mission and vision of Maudsley Learning and SLAM with data-driven, evidence-based practice. So being able to learn from evidence, but also create our own tailored evidence, and being able to apply that and put that into practice through the use of our various different robust evaluation and research practices. So in terms of what we do, we focus on three main things in the research and development team really. The first is around innovations in relation to mental health and in relation to workforce development and the interaction between the two, trying to understand with the use of evidence where there are opportunities and needs and what the ways we might be able to meet those needs are. Secondly, we do a lot of work around educational and workforce consultancy, so supporting individuals, teams and organisations to improve the way they work, often relating to well-being and to performance, and thinking about who the end user is, for example, working in healthcare and thinking about patients and service users. And thirdly, we do a range of different evaluation and quality assurance activities, both internally within our team to make sure that our training delivery and service delivery is as a higher standard as possible, and also in working with other people to evaluate and quality assure their programs and helping other people to be able to work in a similar way. So, in terms of ways of working with us, there are myriad different ways that we love to work with different partners and different people, and we're always open to exploring new ways of doing that. Currently, a lot of what we do is focused around trying to meet workforce needs based on some of the innovations and work towards developing these innovations that I mentioned earlier. So one example would be a lot of the work we're doing at the moment is around staff wellbeing, and being able to access some of the training, innovations and interventions that focus on staff wellbeing, particularly in response to COVID at the moment, is one way to work with us, for example. Following on from that, we really enjoy working with people in as collaborative way as possible. And so, for example, it may be partnering together on a joint bid or a joint proposal to be able to work together across our organisations to meet a particular need we focus in either or both, and being able to do that in a way that is a sustainable partnership and relationship that we look over a longer period of time to be able to make a difference to people's lives, both within our workforce and within the people that our workforces are serving. So that's another really exciting way that we have multiple partnerships with people going on at the moment. A couple of examples that would relate to that work. Firstly, to think about the staff wellbeing stuff that I mentioned. We're doing more and more at the moment around responding to COVID, and a particular theme that we can see coming out in many different sectors, including healthcare, is how to manage uncertainty. As a result, we have a series of learning resources and materials ranging from static self-directed online learning through to more interactive short scenarios and short workshops and sessions that we can run with different teams or across a whole organisation. So a really interesting topic that's coming out of some of the work we're doing. Similarly, we have a huge body of work that's been growing over the last 3 or 4 years around people returning to work. So a lot of that is focused on doctors and other healthcare professionals, but there are some very transferable lessons. And as a result, we've not only developed a suite of training resources that range from multi-day interactive training using interprofessional groups of people, or virtual reality training using a more immersive, engaging online version of training delivery, or working with actually supervisors and mentors who support returners. But alongside that, all that training delivery, we also have a growing research agenda around that. So there's multiple different studies at the moment that are evaluating the products and the sessions that we've been delivering, but also that are looking more widely at how we can create new usable evidence in that area. And so to carry on thinking about the ways that we can work with people, the other is around the delivery of our workforce and educational consultancy services. So this could be a kind of end-to-end service that involves trying to identify problems through diagnostics, trying to develop a plan and a strategy to be able to meet that, actually then delivering some of the interventions related to that strategy and thinking about how those can be embedded and sustained, and an overall evaluation to go alongside. Or it might be that there are specific parts of that process that an organisation needs at a given time. So some of the interventions that we deliver, whether it's some of the training that you've already heard about, or whether it's something different around how do we engage staff through things like developing a network of wellbeing champions. There are various different ways we can deliver those interventions. And likewise, if there's more a piece of work around how do we evaluate something that's been going on or is about to start, or how do we do some more applied research and evaluation around, for example, training needs analysis and just understanding that as a starting point. So again, multiple different ways of working with people, and we're always open to those conversations. One particular example maybe of some of the application of those services I just mentioned is a really exciting project that we're just coming to the conclusion of, working across South East London and looking at urgent and emergency care settings. So mainly the 5 accident and emergency departments across that region. We've been doing some really exciting work around trying to understand what the impact has been for those people of COVID on their well-being, and also thinking about stuff that goes beyond the nature of COVID in terms of working in what can be a very challenging environment. There's been some amazing findings coming out of that. We've spoken to nearly 500 people in different ways to understand what's going on the ground and give us a really good platform for how we can develop some useful strategy and interventions. And we're at the stage now of starting to provide and deliver those interventions and thinking about what the long-term sustainability is. So another really exciting piece of work. So in summary, there's lots of exciting work going on, lots of engaging and exciting opportunities for us to collaborate, and we would love to hear from you in terms of how we might be able to work together.